Hi everyone, this is Neel Raithatha, consultant audiologist and director of earwax. Thank you for joining me in my latest video using the iClearScope endoscope. And here we have a patient who attended reporting really itchy and irritable ears. And as you can see, they've got this very dry, crusted earwax and dead skin. Although it's not occluding their ear, hence why this patient did not report any symptoms of hearing loss or otalgia, so ear pain, or oral fullness. And I did question this patient as to whether they've been poking in their ears, particularly this left one, because it was really impacted and embedded against the canal wall, and the entrance of the ear was also quite sore. But as you probably saw there, I think they're probably scratching the entrance rather than any trauma caused by poking in their ears using a Q-tip or cotton bud. But here, yeah, it's really solidified against the canal wall, and the surface of this wax and keratin is quite solid. So initially the suction tip was hovering over the top of the surface as I was trying to get a suction grip. So I've come away slightly more laterally, trying to get the tip of this dead skin. And as I'm lifting it, or trying to lift it away, you can see that plug in its entirety kind of move. So we've got to be careful because it's quite close to the eardrum already. So as I'm trying to elevate this and retract this off the canal wall, I don't want to be pushing it further up against the eardrum, which would be a bit uncomfortable for them. So now momentarily I've reverted to this full zonal suction probe. Initially I was using the fine end, but it just wasn't powerful enough. So with the full zone, I can get more of a suction grip, which has got a larger surface area. And as you can see, I've managed to lift it away. So this patient's ear canal is very dry and flaky, so I have recommended they use on a regular basis some medical grade olive oil spray, so perhaps on a fortnightly basis. And the way I've instructed this patient to use it is to tilt the ear so that it's facing the ceiling, 2 or 3 squirts of the olive oil spray, let it sit there for a few minutes. And the important thing then is to come back the other way, let it drain out, so you can place a tissue underneath the ear. And as the oil seeps out, not only will it hopefully wash away any small pieces of wax or dead skin that are already collecting in the ear canal, but it will moisturize the skin. So our ears produce natural oils and sweats typically to help keep the skin moisturized and lubricated. But as we get older, and this patient isn't more of an elderly patient, these glands that produce sebum and ceruminous sweat, they become less active, and therefore they produce less oils and sweats, which can mean our ears become very dry as we get older. Also, patients who are perimenopausal or menopausal can also experience similar symptoms, because menopause can affect the sebaceous glands, so they secrete less sebum, and also they produce less collagen, and collagen helps to keep the surface of the skin kind of flat and smooth. And in the absence of the collagen, your skin becomes quite wrinkly, which then can promote additional moisture loss. So just some residual skin right at the top of the ear canal, adjacent to the eardrum, just using the fine end here. I'm pretty pleased with that. It's going to re-enter. So I'm going to see if I can get a bit more out, actually, just at the roof. And just seeing this dry skin and wax, you can imagine it being in your ear, and you can almost put yourself in the patient's shoes and just imagine how itchy their ears must be. But the last thing you want to do, I know it's a temptation, is to poke and scratch in the ear, because that's just going to make it worse. Not only going to push the debris further in, but when you poke and scratch in the ear, you're actually damaging the delicate lining of skin, the epidermal layer. And that epidermal layer, when it heals and regrows, during that healing process, you'll get an itch as a result. So it's short-term gain, which for some can be really, really important. I can imagine even having a short-term relief of your symptoms, it can be beneficial, but you're almost guaranteeing yourself an itch in a fortnight's time by scratching and poking in your ear. So if you have got itchy ears, do visit your GP or your audiologist or your ENT, have them examine your ears. There might be an underlying cause which can be rectified. So moving on to their right ear. So this ear is a lot more narrower at the entrance, and there's a bit more wax. So Sometimes you may hear me refer to earwax and dead skin, and what's the difference? Now, earwax is an amalgamation of 3 ingredients. It does contain dead skin, about 60%, and the remaining 40% is sebum, the oily lipid secretion that I described earlier, and the ceruminous sweat. It's like an oily protein type of sweat produced by the ear. So those 3 ingredients amalgamate to form earwax, whereas when I say dead skin, it's just pure dead skin. There's no sebum or oily sweat in the mix. So here there is a bit of wax, but the wax has got a higher content of dead skin. I would say sort of the average 60% has probably got about 80% dead skin. So the eardrum's fully visible. It's just some dry wax and keratin on the posterior canal wall, and there's a few hairs matted there. So yeah, actually hairs can bind into earwax as well. So there's 4 ingredients. So these hairs are either hairs that may have flown into the ear, so when someone's having their hair trimmed or beard trimmed, for example, or if they're trimming their hairs around the entrance of the ear, or they can actually be hairs that are fallen loose. So the outer third of the ear canal, the cartilaginous portion, you do have hairs there. And these hairs serve several functions. They try and repel foreign bodies, insects, for example, particles like dust, dirt, pollen from entering the ear. They also help to keep the entrance warm, but they also are important in the secretion of sebum and the oily sweat, because at the root, at the follicle of these hair strands, that's where the sebaceous glands and the modified sweat glands are found. And these hairs sometimes can fall loose and they can enter in the ear and mix in with the wax. So just a bit of dead skin left on the posterior canal wall. So this is the back section. We are on the bony section. So the inner 2/3 of the ear canal is very sensitive, so we've got to be careful. We don't want to be bumping into that because it will be uncomfortable for the patient. Again, I'm just peeling this away. Could have used some olive oil. I didn't, for the reason this patient is a hearing aid wearer, and we're planning to leave the clinic with the hearing aids in. So in that instance, I always try and avoid the oil if possible, just because the oil, some residual oil may enter the electronics of the hearing aid and cause it to malfunction. When this patient, when I was performing the left ear procedure, I advised that I've recommended they instill medical grade olive oil on a fortnightly basis. So it's best for this patient to do it at night after taking their hearing aid out. So there's no chance of any oil kind of entering the inner workings of the hearing aid. So you can just see how dry and flaky that skin is. Just gonna have a final look at the eardrum, which looks really healthy. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.